Have you ever wondered why healthcare costs are skyrocketing? Over the last decade, the cost of healthcare has been on a steep upward trajectory. According to data from the Bureau of Labor Statistics, the average American household spent approximately $2,000 more on healthcare in 2022 than they did in 2013. That's an increase of over 25% in less than 10 years. But what's driving this dramatic rise? The answer is multifaceted and complex, but a significant part of the equation lies with the health insurance companies. These behemoths of the healthcare industry play a substantial role in determining the prices we pay for medical services. From doctor's visits to prescription medications, insurance companies negotiate prices with healthcare providers on our behalf. But are these negotiations always in our best interest? Consider this. As healthcare costs have soared, so too have the profits of health insurance companies. In 2021, the 6 largest health insurance companies in the United States reported record profits, collectively raking in a staggering $200 billion. That's a nearly 50% increase from the profits they reported just a decade earlier. This correlation between rising healthcare costs and ballooning insurance company profits is not coincidental. It's a symptom of a system that often prioritizes profits over patients. And while insurance companies certainly aren't the only players contributing to rising healthcare costs, they are a significant part of the puzzle. So, as we peel back the layers of the healthcare cost conundrum, it's clear that health insurance companies play a pivotal role. They are the gatekeepers of care, negotiating prices, determining coverage, and reaping substantial profits along the way. So, it seems clear that health insurance companies play a significant role in the rising healthcare costs. But, is there a way around it? In our next segment, we'll explore the impact of paying out-of-pocket for healthcare services and discuss whether this could be a viable option for saving money. Stay tuned. What if you could pay less for healthcare services without using your insurance? This might seem counterintuitive, but it's an option worth exploring. Let's delve into the concept of paying out-of-pocket for healthcare services. Often when we think of healthcare costs, we imagine insurance swooping in to save the day. After all, that's what it's there for, right? Well, it's not always that cut and dried. The reality is that insurance companies negotiate rates with healthcare providers. This negotiation often leads to inflated prices to compensate for the lower payouts from the insurance companies. Now imagine this scenario. You visit a provider for a procedure. The billed amount is $1,000, but your insurance company has a negotiated rate of $600 for this service. You're responsible for a 20% copay, which amounts to $120. But what if you could negotiate a cash price with the provider directly? Some providers might agree to a lower rate, say $500, because they don't have to deal with the administrative hassle of insurance claims. In this case, paying out of pocket could save you money. You'd be paying less than your original copay amount. This scenario isn't just theoretical. There are real-world cases where paying out of pocket can be cheaper. A recent study showed that for some generic prescription drugs, the out-of-pocket price was lower than the insurance copay in nearly 1 out of 4 cases. However, this isn't a one-size-fits-all solution. It depends on factors like the specific service, the provider, and your insurance plan. Plus, there's the question of transparency. It's often challenging to get clear pricing information before receiving a service. On the surface, it may seem like an appealing option to bypass insurance and negotiate directly with providers. But it's essential to remember that insurance also offers protection against catastrophic costs that could occur from severe or prolonged illnesses. Paying out of pocket, surprisingly, can sometimes save you money. But is this a sustainable solution? That's a question we need to ponder as we strive for a more equitable and affordable healthcare system. Can we, as patients and citizens, influence the healthcare industry? Indeed, we can. We've seen time and again how the power of the people can shape industries and affect change. The healthcare industry is no exception. Patient advocacy and public policy play a pivotal role in shaping the healthcare landscape. Let's delve into how this happens. Patient advocacy is a potent tool. Advocacy groups have the power to bring about change by amplifying the voices of individuals. Consider the success of advocacy campaigns like those led by the American Cancer Society. Their relentless efforts have not only raised awareness about the disease, but also influenced policy changes, leading to more funding for research and better access to care. Similarly, the power of public policy in shaping healthcare cannot be underestimated. Policy changes can significantly influence the cost and quality of healthcare. A prime example is the Affordable Care Act, enacted under President Obama. This policy expanded coverage to millions of uninsured Americans and introduced measures to curb healthcare costs. But what about collective action? Can it influence healthcare costs? Absolutely. When we band together, we can negotiate for better prices and more transparent billing practices. Health cooperatives, for instance, pool members' resources to negotiate better rates with providers. Moreover, we can also influence the industry by making informed choices about our healthcare. By choosing providers who offer quality care at reasonable costs, we can compel the industry to become more competitive. And let's not forget the power of our vote. By electing representatives who prioritize healthcare reform, we can ensure that our voices are heard at the highest levels of government. In essence, we, as citizens and patients, hold immense power. We can shape the healthcare industry to better meet our needs, and we can influence how much we pay for healthcare. By advocating for ourselves and others, by pushing for policy changes, by banding together, and by making informed decisions, we can bring about change. It's evident that we have more power than we might think to influence healthcare costs. Let's recap what we've discovered today. We've delved into the rising costs of healthcare and uncovered the significant role health insurance companies play in this upward trend. These corporations are recording profits like never before, while the burden on our pockets continues to grow. We've also explored the potential benefits of paying out of pocket for medical services. Sometimes bypassing the insurance middleman can lead to substantial savings. But this isn't a one-size-fits-all solution. It's always crucial to do your homework and weigh the pros and cons. Lastly, we've emphasized the power we hold as patients and citizens. By being informed, proactive, and vocal, we can influence industry changes, pushing for more transparency and fairness in pricing. Remember, the healthcare industry is not a monolith, and we are not mere spectators. So the next time you're faced with a hefty healthcare bill, remember, you have options and you have power. Let's use them wisely.